the TCS Healthcare Technologies webinar focusing on the newly released collaboration portal, Acuity Connect. This is the second webinar in a three-part series. The final session featuring Acuity Complete Care is scheduled in May. Please visit the webinar section of tcshealthcare.com for additional details and to register. We are pleased to have three fantastic speakers from the TCS team: Jeff Frater, Director of Partner Development, Linda Killian, Manager of Client Services Operations, and Deborah Keller, Director of Client Services. Before we begin the presentation, please be informed that today's webinar is being recorded and the attendee phone lines will be placed on mute throughout the program. You are encouraged to submit questions by using the question feature in the GoToWebinar control panel. At the end of the program, with time permitting, the speakers will address your questions. The TCS team will follow up with any that they do not have time to address directly via email. Contact information for the TCS team will also be displayed at the end of the presentation. Also, please remember that this is a brief demonstration intended to review some of the most exciting features of the Acuity Connect portal. For a complete demonstration of the full capabilities of this software solution and to see the real-time dynamic data integration between this web portal and Acuity Advanced Care, be sure to ask for follow-up contact. At this time, I'd like to turn the presentation over to Jeff Frater.
Thank you, Michelle, and thank you to all who have taken time to attend this session and learn more about the newest addition to the Acuity suite of products, the collaboration portal Acuity Connect. My name is Jeff Frater, and I'm Director of Partner Development here at TCS Healthcare Technologies. I'm a registered nurse with 20 years of case management experience and am responsible for all sales and marketing activities for TCS. I'd like to ask the others to introduce themselves as well. Linda?
Thanks, Jeff. Hello, everyone. My name is Linda Killian. I'm the Manager of Client Services Operations with a degree in Medical Informatics. I have over 30 years experience in the IT industry, and I've been with TCS Healthcare now for 14 and a half years.
Great. Thank you, Linda. Deb?
Hi, my name is Deborah Keller. I'm Director of Client Services here at TCS. My areas of responsibility include implementing new clients and account management, technical support, and also fee-for-service engagements for our clients.
Great. Thank you, Deb. Okay, before we get started, we did want to take just a few moments and review the topics that will be covered during today's session. First, Linda is going to share some of the history and culture of TCS. After that, I will provide a high-level overview of the entire Acuity product suite. This helps to establish the role that Acuity Connect portal plays in delivering a comprehensive care management solution. Then Linda and I will demonstrate Acuity Connect. For our webinar today, we will play the roles of provider and referral coordinator to illustrate the use cases and features of this portal. Then I've asked Deb Keller to spend some time exploring some of the early return on investment and implementation considerations that our early adopters have been experiencing in the use of Acuity Connect and with its predecessor, AccuExchange. After that, Linda and I will spend a brief time exploring some of the administrative controls, and then, time permitting, we'll address questions. Linda.
Oh, thanks, Jeff. Well, we felt it would be important for you to know a little bit about TCS and some of the things that make TCS different from our other care management software vendors. First is the fact that TCS is a privately held firm with 32 years of experience in developing care management software solutions. Our founder, Rob Pock, developed his first utilization management software program after he met a director of for a health plan in Los Angeles, who asked him for a software program that would help her nurses get authorizations loaded into her claim system. One thing our clients tell us that sets us apart is our culture of service. In fact, many of our clients will refer to TCS as a partner and not merely a vendor. During our time, we have focused exclusively on care management software, and you'll see that clinical focus and thought in the product that enables Acuity to be such a robust platform in support of care management programs. Finally, we are very proud that during our entire history, we have never had a client fail an implementation. We believe this is a testament to the care we take in identifying clients and supporting their implementation process. Jeff?
Thank you, Linda. Before we begin our demonstration of the web portal, we did want to take a few moments to review the Acuity suite of products. Again, this will help you to see the role that Acuity Connect plays in this comprehensive care management solution. First, please note the center of the wheel, the dark blue Acuity Advanced Care circle. This is the central hub of the suite and serves as a powerful workflow, automation, and reporting tool. Last month, we highlighted the enhanced features of version 7.20 of this platform. As Michelle mentioned in the opening of this webinar, if you're interested in seeing a dynamic demonstration of the real-time data integration between Acuity Advanced Care and Acuity Connect, please reach out to me via email or use the Contact Us feature on our website. We would be delighted to arrange for a customized demonstration. Now, let's focus on the add-ons and optional products. First, at 12 o'clock on the clock face, you'll notice the blue logo for Acuity Connect. Earlier, I alluded to the predecessor of Acuity Connect. In 2008, we released AccuExchange, an authorization portal featuring a real-time data integration with Acuity Advanced Care. Based on the success of our customers using that portal and drawing on their experiences, in 2013, we began to build a new web portal with enhanced role-based security features and capabilities beyond authorization, submission, and verification. That became Acuity Connect, which was released in beta in 2014 and is now generally available. At 2 o'clock on the clock face, you'll see the logo for AccuStrat. This is a utility that accompanies Acuity Advanced Care, providing stratification and automation abilities. With AccuStrat, you apply filters to a data set to identify a population and then automate actions in Acuity for the end users. For example, you can set filters to identify diabetic patients that are not enrolled in case management and have not had their HbA1c tested for the past year. Then AccuStrat will create automated tasks for the care manager to contact the patient and their PCP to arrange for the test to be completed, thereby closing the gaps in care. At 4 o'clock, you'll notice the yellow logo for AccuPort. This utility also accompanies Acuity Advanced Care and is how we move data into and out of Acuity. At 6 o'clock, you'll notice the light blue icon for AccuPrint. This is a batch printing utility for letters and educational materials. At 8 o'clock on the clock face, you see the orange logo for AccuTab. This is very different than the previous in that AccuTabs are not utilities or other software, but instead optional displays or views within Acuity. These allow the care manager to see data from other systems, such as claims, pharmacy, or labs. Overall, this helps improve the efficiency of the care manager in reducing the need for them to log into or access the data in those other systems. Finally, at 10 o'clock, you'll see the purple logo for AccuCare. The AccuCare programs are optional diagnosis-specific care planning content programs that are fully integrated with the standardized care planning functionality in Acuity. We feature AccuCare programs for asthma, diabetes, COPD, coronary artery disease, heart failure, and high-risk pregnancy. On the slide now, we're going to review some of the more exciting features that are present in Acuity Connect. We, at the outset, want to emphasize with you that this portal is branded a collaboration portal because the use case goes far beyond the submission and verification of pre-authorization requests. First, note that Acuity Connect features a real-time data integration with Acuity Advanced Care. This means that entries in one platform are instantly visible and present in the other. Unlimited user accounts is a key feature as well. This means that you'll experience no fees for each user that you add to the system. You can expand the use of the portal to as many team members as needed. In fact, based on your user needs, you could elect to have some remote staff complete some of their work via the portal. You'll see we've increased role-based security controls. Also, Acuity Connect includes secure messaging and file sharing between the Acuity users. Of course, there's eligibility verification, and users can submit and monitor pre-authorization requests. Acuity Connect also allows the user to view other care team members. These are generally providers affiliated with authorizations or cases in the Acuity Advanced Care System. Users can complete assessments such as health risk assessments or case management enrollment assessments. And finally, the Connect users are able to view care plans that are present within the care enrollments of Acuity. So we'll explore these features and more as we explore and demonstrate Acuity Connect now. So give us just a moment while we switch to the application. Okay, you should all be seeing the home screen of the Acuity Connect collaboration portal. And again, Linda and I thought that to enhance today's presentation, we would demonstrate Acuity Connect with the role-based scenario. In the following skit, I'll play the part of a physician, and Linda will be my referral coordinator. We hope you find this as enjoyable as it is informative. Linda, I need to enter an authorization request for Tori Cook to have neurodevelopmental testing. Can you show me how our new web portal works?
Sure, yes. First, I want to share with you that the health plan staff explained to me that they've configured the role-based security of Acuity Connect so that we're only able to view and edit the records of members for which you are listed as the PCP. If you are a specialist, our access would be defined by the provider networks you are a member of. So here I've logged in. Oh, I see we have a message from the authorization request that we submitted yesterday. It looks as though they need additional records for Mrs. Davies' MRI request. See here, they're asking for the results of her CT scan.
Oh, good. I have those records, and we can share those easily enough.
Okay, great. Well, notice I'll just double-click on this message, and it opens to the member records screen, where we can see all of her previous authorizations and other messages. At the bottom of this screen, I can see the new message, and I can click the reply here. So see how I'm able to use the file navigation screen and drag the CT results into the message. So I'll find my Windows Explorer window, look for that particular file. 1 second here. And if we can coordinate our windows, I'll drag the CT results scan file into the Acuity Connect message window and attach that file. All right, getting coordinated here. Pardon the break.
Sorry about that.
So there we go. There's our file connected into the message. And I'll just type in a quick reply like, please see CT results attached. That message goes back to the health plan as I save and close. And we're all set with that.
Oh, that was pretty easy.
Yep. So I'm going to go ahead and close Mrs. Davies' record now, and let's go find Tori Cook. So once again, I'm back on the home screen. Now I'm going to click on members to find Tori. I could click on the funnel icon to search by member ID, member name, or date of birth. But in this case, I think I'll just use the simple search in the upper right corner. The advantage of the simple search is that it will search across all of the data fields that we see here on the screen. So to demonstrate, I'm just going to type in the letter C. As I do that, it brings back many results for us.
Linda, what are the red and green and the S's and the P's that I see in that far left column?
That's a great question. The P indicates primary coverage, and the S indicates secondary coverage. The green lets us know the patient has active coverage with this plan, while the red tells us their eligibility has expired.
Okay, I see that now. So can we find Tori Cook to do that authorization request?
Sure. So let's just reset our filters. Now I'm going to search by member name for Cook. So I see we have a few results, and okay, well there's Tori Cook. I can confirm the right Tori Cook by verifying her member ID of A12345 and the birth date of October 15th, 2011. So this is the one I want. I'll double click her entry and open and view her member record. We can see all kinds of information here on the screen. Like across the top, we see a summary of her basic demographic information. We can double check that we still have the right member by verifying her ID and her date of birth. And I see you listed as her PCP. So here, this button that's pressed confirms we're on the member summary screen. You can also see the authorization button and the care enrollment button. We'll come back to those in just a little bit. So it looks like, according to the health plan, she's allergic to eggs. Below that, we can see her eligibility listed. And it looks like she's still eligible on the commercial diverse coverage plan. I see she also has coverage under the state Medicaid plan.
Oh, but what's this care team I see?
Well, Jeff, the care team members are the other providers that have worked with Tori in the past. So it looks like Dr. Pennyman was her admitting provider when she was admitted to the hospital back on April 1st.
Oh, and I see under authorizations there was that admission to St. Francis Hospital on April 1st as well.
That's right. And along with authorization for the visit, she had Dr. Martinson earlier this year.
Oh, okay. What's the care enrollment?
The care enrollment just explains that she was in, or still is active in the complex case management, and she's active with her case manager this time.
Oh, that's right. I did refer her to case management in January. So what kinds of information would we find there?
Well, let's look at her care plan after we're done entering the authorization. So to do that, I'm going to click on the authorizations button. Now we can see all of her authorizations. Let's click on the new outpatient button in the upper right corner, and that will open up the window called New Outpatient Auths. We'll make sure this is her primary coverage across the top. You can see request type is defaulting to standard prior to service. We could change that to expedited if we needed to. We'll leave the request date and time to reflect right now. And by the way, I understand the health plan could have this entry filled in by default and then lock that field down so we can't change that. So what's the setting going to be?
Well, show me what the options are.
Okay, here.
Okay, so this will be at the physician's office, I imagine. So let's choose physician's office.
Okay, great. Got that one. And how about the service type?
Well, let's look at the options there. I'm pretty sure this would be behavioral health since it's for neurodevelopmental.
Okay, great.
And then we'll just do one service now since it's the testing.
Okay, great. And is today's date okay for the requested start date?
Sure.
All right. All right, and the procedure, what do you think we should use for code?
96110 should do the trick. And, yep, I see that's for developmental screening. Good.
Great, we'll use that one. And just so you know, we could use the ellipsis search button to look up any CPT code by the description for those times when you know the procedure you're looking for, but you don't know the actual code.
Well, that's good.
Yeah. So let's put you in as the requesting provider. There we go. And how about servicing provider?
I'd like to send her to see Dr. Newman.
All right, let's see if we can find him. I don't see him in the drop-down list. If we click in this ellipses, we can search further by his last name.
Nothing's coming up.
Yeah, that's right. You know what? Now I remember the health plan staff told me it would only be set up to show us providers that are within this patient's network.
Oh, so Dr. Newman must not be in there.
Right.
How about Dr. Gilman?
Okay. Well, let's look up Dr. Gilman.
Oh, there he is.
Great. He's in our drop-down list. Perfect. I see him. And, all right, so we're up to the diagnosis code.
You know, 315.9 is the developmental delay nonspecific. That should be appropriate.
All right, we'll enter that one in. And for clinical findings, I usually type in things for you like not meeting developmental milestones for motor or speech skills.
That's appropriate.
All right, great. We'll use that. And then for treatment plan, I usually type in something like neurodevelopmental therapy based on the outcome of the screening.
That's perfect.
Okay, we'll use those two. And down on the bottom here, notice we can attach other files to this authorization if we need to do that, just by drag and dropping.
Just like we did for Mrs. Davies.
Exactly.
Okay, very good. Well, everything looks complete. I guess we can go ahead and submit now.
Okay, let me just mention one more thing back on the red labels of the screen, just so you know. Those are set as mandatory fields.
Oh.
So we're required to fill out all the red fields before we're allowed to submit. So I think we're good to go here.
Okay.
I'll hit submit. And there we go.
Oh my gosh, it says it's approved already, Linda.
Yeah, that was great. So I'm going to step out of character here just for a minute and explain an important point to everyone. This authorization was set to auto-approve because in this case, we built a very simple business rule in Jeff's Acuity Advanced Care environment that this particular CPT code, 96110, will always show up as an auto-approved auth. Now, in most cases, you would expect additional parameters that would be used to determine if a request would be auto-approved, such as is the member eligible, is the provider in network, or is the provider's specialty appropriate for the request? Has the patient met certain pre-service criteria, like is there a claim for a neurodevelopmental screening? And many health plans have lists of codes or services that are always approved but require a notification, like a routine vaginal delivery.
So we do want to be clear. Acuity Connect is not programmed to always automatically approve CPT code 96110. That's a business rule that we applied strictly for demonstration purposes. In fact, out of the box, the Acuity request to suspend it. And then later, Deb is going to talk just a little bit about the implementation considerations and how the thought process that folks go through as they look at what would auto-approve versus suspend.
Great.
Okay, well that was pretty easy. Can we look at her care plan now?
Sure, let's go ahead and do that. So what I'll do now is simply click on the care enrollments on her main member screen. We can see complex case management cases listed. In the lower half of the screen, we also see notes, assessments, messages, attachments, and care plans. Notes are general, free text notes regarding the member, the authorization, or the care enrollment, and they're entered either by the care manager at the health plan or other members of the care team using Acuity Connect.
I see. It looks like Tori's mom was concerned about her nutrition when she talked to the case manager.
That's right. And then assessments are either those that have been completed by the case manager and shared with the portal users, or assessments that are able to be completed by an Acuity Connect user. So see, when I click assessments and then I click the new button, it looks like we can choose either a discharge planning assessment or a diabetes assessment. And Jeff, I understand the health plan care management department creates these assessments and enters them into Acuity Advanced Care.
Okay, that makes sense. So it doesn't look like any assessments have been completed on Tori Cook, at least not shared with the portal.
Not yet, correct.
Okay. And I see messages and attachments, and those are the same things that we worked with Anna Davies. Is
That's
that
right.
correct?
You're correct.
Oh, good. Okay.
Yep. So now notice the blue dot is on the tab for the care plan. That tells me that there's an active care plan on her case management case. So I can click on that blue dot and see her care plan.
Goals, interventions, and outcomes that are associated with a diet and nutrition concern that her mom was talking to the case manager about.
That's right.
Okay. Yeah, I remember after the case manager completed the assessment, she told me I would be able to find the care plan in the portal.
Yep, there you go. Lots of information for you.
Okay. You know, it just reminded me, Linda, that the home health agency that has been seeing Mr. O'Donohue has asked for 4 more visits. Can we go ahead and do that while I'm here?
Yeah, absolutely. Let's return to the home screen, and we'll search for authorizations associated with patients that our role-based security allows us to access. So first, I'll click on the Authorizations tab. And this time I'm going to use the column-specific search by name. Notice the search parameter automatically comes up with contains, but we could change that to starts with if we needed to. For right now, I think I'm going to leave it as contains, and I'm going to simply type in the letter O. Now we see all the authorizations associated with all of your patients that have an O anywhere within their name. Here on the left side of the screen, we can simply apply this quick filter for outpatient. So we're only seeing outpatient authorizations for your patients with an O in their name. And here I see the request for Mr. O'Donohue has been approved. So from here, I'm just going to double click on that line for that authorization, and it displays all the auths associated with Mr. O'Donohue. If I need additional details about a particular auth, I'm able to double click on that line again, and we see all of those details right here.
Okay.
Now notice I can add additional services with this button. That opens up a new window, and we'll enter in your extra services. So I assume this is still home health.
Yeah, and look at that. They have the home health physical therapy. Okay.
Great. Number of services you wanted 4.
Yes, that's what they asked for.
Okay, great. And what CPT code should we use now?
97110 is just a general physical therapy code that I use.
Okay.
And we'll continue with the same home health agency, Horizon Home Health.
Okay, great. So now that we've done that, all I have to do is save and close. Oh, should we put in some more comments? Might as well put a little more information in here.
And I see that I can attach the physical therapy progress notes again, just like I did with the others if
Right.
we needed to.
Perfect. Okay.
Excellent. That's okay.
So now I'll save and close. And it goes to suspended.
So these other ones that we're seeing were the previous ones that were approved?
That's right.
And here's the one that we just entered and is now suspended.
That's right.
Oh, okay.
So that went to suspended mode, but that's going to be reviewed by the health plan. And then I can come back and check tomorrow to make sure that this has been authorized as well.
I see. Okay. Hey, Linda, it looks like you have Tori Cook and Mr. O'Donohue's records open at the same time.
I sure do. That's right. In fact, I can have up to 5 member records open at the same time if I need to. This helps me be more efficient. So, for example, if I'm working on referrals you gave me this morning, and then you stop by my desk to have me check on another patient, I can keep that record open that I'm working on and then help you find the other information you need on the other patient.
Well, gosh, Linda, this is great. Is there any chance you can get me a login so that I can look up the care plans of my patients and not always have to come to you for help?
Yeah, sure, absolutely. The health plan told me they have unlimited user accounts on this system, and they'd be happy to create one for you also.
Okay. So that was perhaps a little corny, but hopefully it made it just a tad more enjoyable, and you were able to see some of the features of the Acuity Connect portal. Again, I want to reemphasize that we've expanded beyond authorization requests, and you should see that in the notes, the assessments, the messages, the attachments, the care plans, etc. So now we're going to switch gears a little bit, and I've asked Deb to take some time to explore with you some return on investment and implementation considerations. So I'm going to pause the screen for a moment while we shift gears. Okay, Deb.
Thanks, Jeff. So return on investment is something we quite frequently are asked to speak to with both prospective clients and also now our existing clients who either are on our existing portal and considering the Acuity Connect portal, and also existing clients that are looking at our portal as a replacement for a portal that they have, or maybe this is the first portal that they're going to have in their organization, and as they should, they're looking at return on investment. And if you look up the definition of return on investment, quite simply, it means, is it going to more than pay for itself? In other words, if I'm going to spend this much money and have this many people using it, is what I get out of it going to be greater than what I've spent? And there's a lot of ways that you can look at return on investment. And when we were designing this product, I'm really proud of this product. The client services clinical team was the decision driver in a lot of the user interface with this product. We really challenged ourselves to make sure that we're creating a product that does pay for itself, and it is simple to use, and it has the features that our clients want and need. So in looking at what we wanted out of this product, we had to look at different considerations in the realm of return on investments. Considerations. We wanted to make sure that we were offering a product that a client can look at the volume of authorizations and touches that they're currently doing in their process, and we wanted to offer them a portal that could decrease touches, or in a lot of cases, as we saw in the demonstration with the auto approval, make there be no touch necessary at all, which is really good. We also wanted to provide a solution that helped our clients with their turnaround times. We know that when authorizations come in, the clock starts ticking. And so again, when you have a portal that allows you to have a certain percentage of your authorizations that either have no touch from receipt to decision point, or fewer touches, we're helping you show better turnaround times, and certainly offering you some metrics and being able to better manage and measure the turnaround times. We also looked at information gathering and also gathering not only on the part of our clients, but also on the part of the outside entity, the portal end user. You're getting information from them, but they're also able to get information from you. We saw in the demonstration, Linda was able to share with the provider or the portal user. They can see who's on their care team, what programs are they enrolled in, beyond the realm of just an authorization. As that authorization piece is taking place, you're sharing extra information easily. Not just in the care team, but also messaging, assessments, document sharing. All of these can be woven throughout your workflows, where you're sharing and gathering information between yourself and your end user on the outside. And then finally, cost shifting. Not just the apparent, the evident, the obvious cost shifting of now I don't have to have as many prior auth people touching prior authorizations, but more sophisticated cost sharing. You can take those same nurses that were touching some of your high volume items that now maybe you're auto approving or gathering more information, and now they can do higher level functions such as case management, disease management, medical cost analysis interventions, risk measurement. So a lot of considerations went into, we want to, again, look at the return on investment with each client as we go, but just all the way back to the design of the product, we're hoping that we have pre-thought a lot of what you're going to be looking at to see that this product really is improving your world on the side. On the case management side, very similar. There's considerations there as well around return on investment. The most obvious is maybe you have a mandate that you've got a regulatory program deliverable that you have to share care plans with PCPs. You have to show a collaborative care team that's sharing information. You have to show that you're providing multiple sources of entry into your case management and disease management, and the portal checks that box. That's an obvious one. But the less obvious ones, again, that we really want our clients to experience a greater gain in their spend. We want that gap to be very wide in the fact that you've opened up pathways of communication, not just in referrals coming in from providers into your various programs, but also true collaboration. You can, as Jeff and Linda showed, we have a real-time interface, so there's not the delay in information sharing, and it's also a shared database. And what I mean by that is the assessments that perhaps your team is doing internal to your walls, you can now publish those out on the portal and have some of that assessment gathering done by your portal users who are closer to the information. And finally, document sharing, things like living wills, powers of attorney, guardianship information, things like that. You have a way of getting that information a lot easier. And then finally, again, the information gathering and sharing, much the same on the side. You have an ability to get information from outside your walls to inside your walls to increase the experience, the positive experience of both of your users inside the walls, outside the walls, and most importantly, your members and your patients. Okay? So switching gears here a little bit, so what does all of this mean? So you make the decision that, yes, this product does have a high probability of a good return on investment. You're opening up these pathways. You've got information flowing from inside the walls to outside the walls. You're collaborating. Well, how do you make all of this happen? Well, there has to be a successful implementation. And so the kinds of things that we work with our clients to really think about as they are considering implementing Acuity Connect are, the most obvious, again, who are the users going to be? And I say target user group because what we're seeing happening is you'll have the obvious user groups, which are your provider offices submitting authorization. And as we have the conversation during the implementation, that user group tends to grow as we engage with the prospective and existing client to think through how they're going to use this product. We find our clients are finding just many creative ways to bring other users in beyond, obviously, the most pedestrian of authorization submission. And then again, target workflows. So flowing from that same bullet point here, sometimes we end up with workflows that our clients figure out that, wow, this portal can do this, and it can do this, and I can do this. And so we work with you to develop those workflows that are congruent with your Acuity platform because, again, it is the same database. I like to say that Acuity Connect is kind of an expression, if you will, outside the walls of what's going on in Acuity. So we create those congruent workflows that really make life easier for everybody. Target workflows, the ones that we're seeing that we're implementing for our clients now are obviously prior auth with a lot of auto approval, concurrent review, retro review, assessments being published out, HRAs. There's a lot of energy on getting the HRAs out to the portal so that maybe someone in the office, the provider's office, can help the member fill those out. Attachment sharing, messaging, care team support, the list goes on and on and on as far as what workflows the application will support. And then finally, security. As we all know, security with the portal solution is always a big consideration. And in just a moment, Linda, I think, is going to talk through some of the administrative controls. And again, back when we were designing this product, we wanted to make sure that we handed the controls to our clients to be able to decide what level of security do they need in order to do what they want the end users in the product to do. So what you're going to see is kind of a two-pronged approach to security, where you have a system access, that who gets a user log on and what functionality can they see in the system. But more importantly, we have a member role that Linda's going to talk about, which really gives you the capability of doing that next layer of security around not only who has access and what can they see, but also who can they see and what parts of their record can they see. So final note here of interest, and something I thought was very interesting, our QA manager, when they were doing quality analysis on their product, they came back to me and said, Deb, these crazy security controls that you put in place, if you run all the permutations of possibilities of how security can be set up, it's over 6 million combinations. Obviously, you're not going to have all 6 million set up, but it is a consideration, and we work with you carefully during implementation to, again, make sure that you take our product, you get more from it than you ever would have dreamed that you were going to get, and that your users are happy with it, and at the end of the day, our clients are helping us define more and creative ways that this product can be used, because we have the core competencies and pieces that you need in place, and we've given you the controls to really take this tool and make it your own. We're very proud of it.
Good. Well, Deb, thank you so much. Okay, we're going to switch gears now, and we're going to go back into the portal. We're going to spend just a few more moments with that. And what we wanted to do, as Deb mentioned, is take a few moments to explore and demonstrate some of the administrative controls that are present within the web portal. So what I'm going to do here is simply come up to the upper right-hand corner and just kind of walk through some of these menus, again, at a very, very high level. So first, I'm opening users. And as you can see, in this demonstration portal, I have a very limited number of actual users. But as you can imagine, this is where the Acuity Connect system administrator can manage the user accounts. Notice there's the Import Users button. This allows you to import a large comma-separated value file for when large volumes of users. As you can imagine, this is really crucial during the implementation that Deb was just describing. Next, under the Tools menu, we see Security Roles. So in short, we use the security roles to create a role that defines what a user is allowed to do. And not a specific user, but a user role that would be assigned or affiliated with the user. This includes administrative controls, but also, and probably more broadly, read, edit, or the ability to create records. And so this is the first of the two-part role-based security controls. I'll close the security roles and come back up to Tools. And now we see member roles. So the member roles define who a particular role is allowed to view or access. In other words, which groups of members are the users allowed to see and work with. So in the demonstration, Linda mentioned at one point that I would, as a PCP, would be limited to my group of patients, and that would be a role that would be assigned to me to see my patients that I'm assigned as a PCP. Whereas a specialist may have a different role that is defined by the patient's group or network. But this, in essence, is the second part then of the role-based security. When I come back up to Tools and I click on the System Options now, what you see here are a number of different configuration and other controls for the Acuity Connect administrator to customize the web portal to meet your business needs. You can see that this includes menu options for configuration, general, migrating data, and then additional security. So here under configuration, you can see a number of different configuration controls that you can put in place. Some general things, such as including your company logo or name so that it is essentially white labeled. Migrating data is designed for after you set up your test and development environment and you have the configurations the way you want, you can simply import those configuration controls into your production environment. And then finally, security. Here you'll see these are not the security controls that are specific to role play security, but things such as what are your password requirements so that you can tailor those to the specific HIPAA and high-tech security controls that are required or part of the policy for your organization. Closing that, and finally, let's take a look at the field properties. As any good Acuity Advanced Care super user knows, field properties are key strengths that allow both the Acuity Advanced Care and now Acuity Connect to be configured to support your organization's unique business and workflow needs. Notice here, when I click on one of these field properties, so I've opened up an outpatient authorization form. This is the same form we signed when we entered the authorization request for Tori Cook. And then once I click on a particular field and I say enter a new field property, now you can see the properties that are available, such as make the field mandatory, cause the field to have a default value. You can disable a field, or you can go one step further and hide the field so it's no longer visible on the screen. In many of our assessments, we use computed fields. So as you answer questions throughout the assessment, there may be some type of computation that displays and drives some decision support. There's the option to notify on entry. So when an end user makes a particular entry in this specific field, it may send them a notification, such as complete the assessment in order to have an approval. Notify on save is the same concept, but instead of that occurring when the data field is entered, the notification occurs when we save. And it may be a notification such as this will be referred to case management, or you'll be contacted regarding authorization follow-up. And then finally, the field labels, so that you can take the fields that are out of the box and then modify those to reflect the data elements that you need to capture. Okay, so that was a brief look at some of the administrative controls that are available here in the Acuity Connect. And with the time that's remaining, we're going to turn it back over to Michelle and see what additional, if any questions have come up for us.
Okay,
Michelle?
guys, thank you for all the great information. As time runs down, we'd like to take a few minutes to answer some of the questions we got from attendees. If we do not have time to answer your question, please know that a member of the TCS team will be in touch to follow up with you personally. Now, Linda, I think these questions would be best suited for you, so let's go ahead and start there. One of the attendees would like to know, do I need to already own Acuity Advanced Care in order to implement Acuity Connect? And if so, which version do I need?
Okay, that's a great question, Michelle. Thanks. You do have to own Acuity Advanced Care. It is the core product for the system and the platform. And Acuity Connect and Acuity Advanced Care actually share the same database, so they're linked together. And the version that's required for Acuity Advanced Care is the newest version release of 7.20.
Okay. It looks like another attendee would like to know, is there a limit to the number of users I can have inside Acuity Connect?
That's a great question as well. Acuity Connect has unlimited number of users. So you can actually add on as many new folks as you need to use the collaboration portal. So that's a great question. Thanks.
Okay. Okay, let's shift gears a little bit and go to some questions for Jess. Can more than one Acuity Connect user access the same case and patient record at the same time?
Well, just like the Acuity Advanced Care environment, the records, due to database controls and data integrity, can only be edited by one user at a time. but records are able to be viewed by multiple users simultaneously.
Okay. Popular question we got during the slideshow. Will the webinar presentation and slides be available for attendees afterwards?
Oh, yes, of course. We have recorded the webinar, and it will be made available on our website in the next several days, and you should get notification of that with the follow-up email as well as the slides.
Okay, great. It does look like we have time for a few more, so let's go ahead and shift gears once more. Now, Deb, I think these questions would be best suited for you. So on average, about how long does it take to implement Acuity Connect?
That's a great question. So we have a couple of nuances there, and I'll answer both ways. So for a new client, as we just discussed, you have to have Acuity Advanced Care platform implemented as well, or already be an existing client. So I'll answer the question as if we're discussing a new client, and then switch over to an existing client who wishes to. Our average implementation averages between 4 to 9 months, including all of our suite of products. Thinking back to Jeff's Daisy Wheel, depending on the number of products that you purchase, and then also how the resource side on the client side, that's kind of our average implementation time frame for a new client, including if they were to elect to implement Connect as part of their implementation. For an existing client, typically it's anywhere from 8 to 12 weeks to implement the Acuity Connect portal. Again, coming back to those considerations on implementation, we all have to look at what all kinds of end users are you implementing, how many workflows are you trying to implement, how much auto approval are you trying to set up out of the gate. But again, typically we're looking at an 8 to 12, maybe 16-week project for the more sophisticated needs. Okay.
For one more, Deb, again, what are the first things you need to think about when you were getting ready to implement Acuity Connect?
Oh, that's a great question as well. So just taking the question a little higher level, like any project, you have to begin with what's your goal? What are you trying to achieve? How do you know at the end of the project that you won, in other words? So I like to work with clients to really understand, even, Jeff even actually begins before our clients buy a product. We really want to make sure that the vision and the goal in the mind of the client is aligned with the product. In other words, we want to sell you the right product first of all. Then we want to implement it the right way. So I would say that one of the first things to think about when considering the Acuity Connect portal is, let's make sure it aligns with what your business needs and your goals are. And then the rest of it is all just
great.
Okay, great. Thank you again for all that great information. It was really informative and interesting. Again, if you asked a question that was not addressed during today's webinar, don't worry. A member of the TCS team will be in touch with you in the next few days to follow up with your specific questions. As a reminder, we hope that you enjoyed today's Acuity Connect presentation and will be able to join us for the May presentation focusing on Acuity Complete Care. Also, again, please remember that this was just a brief demonstration intended to review some of the most exciting features of the Acuity Connect portal. For a complete demonstration of the full capabilities of this software solution and to see the real-time dynamic data integration between this web portal and Acuity Advanced Care, be sure to request follow-up contact from Jeff or Deb. They can be contacted via the email addresses showing on the screen right now. On behalf of the entire TCS team, thank you so much for joining us, and we hope to hear from you soon.